Hey everyone, it is Fibromyalgia Awareness Month, and we have been talking about the latest and greatest treatments for fibromyalgia. And we would be remiss if we did not at least talk about naltrexone. Although it's not a new medicine, it does have some utility in some circles. I am Dr. Dustin. This is the Dr. Dustin Show. Let's get into it. So it is the 1960s, and there seems to be a great interest in treating opioid addiction during this time. This is when buprenorphine was first being studied, and a lot of other treatments for the purposes of addiction, methadone. Well, one treatment that came out during this period was naltrexone. At least that's when this drug was invented. But it wasn't actually approved, FDA approved, for the treatment of opioid addiction until 1984. Now, naltrexone is not a pain medicine. Actually, it's an opioid receptor antagonist. And that was the reason why they thought maybe it worked for opioid addiction. In 1994, they found it to be useful also for alcohol use disorder, and so the FDA approved it at that time for that treatment. Well, many years went by, and there seemed to be a renewed interest in this idea of fibromyalgia. See, the American College of Rheumatology came out with its initial diagnostic criteria in the 90s, and then there was more talk and more research, and then it was until 2010 did they start making revisions to their diagnostic treatments. Well, in the years up to this, 2007, we had pregabalin FDA approved for the treatment of fibromyalgia. 2008 was duloxetine. 2009 was milnacipran. And of course, in 2025, we have Tonmya, which we talked about in an earlier episode. So during this lead up to 2010, we have some more studies now looking for other things that could be used for the treatment of fibromyalgia. And so there was a small study that came out of Stanford, a pilot study, if you will, that looked at naltrexone. Now, naltrexone, again, it is just an opioid receptor antagonist. And in this study, they looked at a very small study, just 10 female participants with fibromyalgia, and they found that it was actually effective. Low dose naltrexone reduced fibromyalgia symptoms in the entire cohort with a greater than 30% reduction of symptoms over placebo. This pilot study then led to a larger study also done at Stanford just a few years later, and they continued to find a significant difference. This was a double-blind, randomized controlled trial, and they found that those who were treated with naltrexone had significantly greater reduction of pain than those who were taking placebo. 28% reduction versus 18% reduction. So this was a big study out of 2013, I believe it was, and it sort of launched into the next decade for off-label use of this medication for the treatment of fibromyalgia. In fact, it was commonly part of treatment plans, whether you were in pain management or rheumatology. And the idea behind why this medicine worked is probably a few different theories. One is that, well, it's an opioid receptor antagonist. And so people were using it before for opioid addiction and alcohol use disorder. They were using 50 milligrams per day. In this case, and in these studies, we were basically microdosing it. Each daily dose was about less than 5 milligrams. And so by basically just teasing these opioid receptors, by blocking them, we thought that maybe it could increase the endogenous production of your own endorphins, your own opioids. And by doing so would result in more pain relief. There were some other things that went along with it, such as the inhibition of the microglia inside the brain, microglia sort of being the helper cells within the brain tissue. And they were very responsible, heavily responsible for the inflammatory response, the neuroinflammatory response, and coordination with the immune system. So the idea was by inhibiting some of these cells' actions, we could reduce the central sensitization and the neuroinflammation that we think is so commonly prevalent in fibromyalgia. Well, that's what led in, again, to the next 10 years, people using it, probably with mixed results. Again, all off-label for the treatment of fibromyalgia. Then there was another study. Now, this study came out in 2024, and essentially this was a Danish randomized controlled trial. And what they found is that there's actually no benefit with this medication compared to placebo. And as you can see there, it's like, okay, well, we have, again, a robust study, 158 participants this time, much more than the previous pilot and subsequent studies coming out of Stanford. And now everybody's confused. Well, we have a very small and a little bit larger study supporting it. Now we have a bigger study arguing against it. Where do we go from here? Perhaps most recently, there was a final randomized, I would call it a meta-analysis, and they looked at 5 randomized controlled trials in this meta-analysis. And although the results were, we'll call them small, low dose naltrexone was superior to placebo in alleviating pain. So there you have it. We have a meta-analysis now confirming there is a small but a real benefit, let's say, to the use of naltrexone. Is it commonly used? Well, I don't commonly use it. I'll tell you that. It is a cheap medication, although it does have to be compounded. It is used off-label, but it is well tolerated. So if you've already tried everything else, if you've tried the pregabalin, duloxetine, milnacipran, the latest one on the market, Tonmya, and of course you've done all the non-medicinal interventions, right? Because that should be forming the core of your treatment plan. Maybe this medication is right for you, but maybe not. If you're watching this video, let me know below. Have you tried naltrexone? Does it work for you? Did it not work? I would love to know, because really the studies are still out on this. We have some saying yes, some saying no. Let me know in the comments. Until next time, you guys take care of yourself and keep honoring Fibromyalgia Month. Support those that have it. We'll talk to you later.